Singaporeans can look forward to the return of greater normalcy. The health minister says that the COVID-19 situation here remained stable over the Chinese New Year long weekend. Singapore's pandemic restrictions, such as limits on people gathering, have almost all been lifted except for those compulsory mask-wearing situations in healthcare settings as well as on public transport.
We always brace ourselves after a long weekend, always a big spike in numbers, as well as a big spike in visits to emergency departments. As it turned out, wasn't too bad. Numbers went up to about 500. Emergency departments held their ground, including the most busy hospitals.
Mr. Ong also assures that the wave of infections in China hasn't had a significant impact here in Singapore. Since December, there remains only one case arriving from China who needed hospital care, a returning Singaporean.
We've also been watching the numbers. Over the past week, the number of imported cases from mainland China is zero. There were none. Either that or they are so mild, it's treated no different from a normal influenza. So the number of travelers from China that got infected and entered our hospital is what matter more.
For more on what this might mean for Singapore's COVID-19 restrictions, we're joined by Tiki Pang, visiting professor at the Yong Lu Lin School of Medicine at NUS. Professor, are we at a situation at a point, or are we approaching the point where the situation is considered stable enough to roll back the remaining restrictions, or do we continue to play it safe?
Well, thank you, Jill. I think, as the minister said himself, the situation's pretty stable. Only a small surge during Chinese New Year, no big number of imported cases, no increase in hospitalizations. So I think the situation is pretty stable, only about 200 cases a day. But I think to continue to play it safe seems to be a prudent strategy, especially around those measures that we know have worked in the past, like what Don mentioned, wearing masks in healthcare facilities as well as in public transport. So stable, but continue to be vigilant.
Professor Pang, enjoying that stability as we do right now, if we were to roll back restrictions, which ones would make the most sense to actually tweak at this point?
Yeah, I was wondering about that question. In fact, there are not that many restrictions left to roll back, I mean, just my own personal view, if there was one that came to mind, simply because I experienced it myself, is around sort of border control measures. And I'm referring to the Singapore arrival card. Okay, as we know, Singaporeans and long-term pass holders that have been vaccinated that are coming from Johor no longer need to fill in those arrival cards, but it still applies to air travelers from abroad. So I'm just wondering, border control restrictions generally don't serve any purpose. So I'm just wondering why that sort of restriction is still there. If I had to probably name one, that would be one that I would consider rolling back. There could be sort of other reasons for it to keep track of the number of tourists, but from a health medical perspective, it probably is one that you could consider removing.
Professor, it's still prudent, though, to be aware of new variants developing around the world. What do you think are the risk factors for new subvariants that we're seeing overseas?
Yes, absolutely. Obviously, that's going to be a possibility. Okay, I would say there are three risk factors. First is a virus that is highly transmissible, that spreads very quickly. Secondly, a large population that have suboptimal vaccine coverage. And the third is sort of complacency around attitudes and practices that allows the virus to spread in a large number of people. That is the trigger for the appearance of new variants.
And Professor Pang, some of that complacency is also being seen with vaccine taking as an example. Not everybody is necessarily up to date with all of their vaccines. certainly not with the bivalent. I mean, we're seeing the numbers growing. But do you think that our current strategy with vaccination should evolve further as we see the stable situation as it is?
I personally think that the Singapore vaccine strategy is actually very good. Okay, it doesn't, I mean, if it needs to evolve, only should there be a new variant of concern, the term that WHO uses, that not only spreads more rapidly, but causes more severe disease. But at the moment, I think the strategy is fine, is to maintain high level of coverage, which is around 82%, and importantly, to protect the high risk and vulnerable segments of the population, especially the elderly. And that's a little bit more of a challenge to maintain a high level of coverage. But I think overall, the strategy is fine.
We still need to make sure that we're up to date with our vaccinations. Professor Pang, thank you very much for that. Tiki Pang there, visiting professor at the Yong Loo Lin School of Medicine at NUS.